in terms of kids in school today, they use laptops and there's wireless. So I don't know what's going on all over the country. I just know in my area that the norm is kids take notes on a laptop, or at least high school kids take notes on a laptop. It's connected wirelessly. Is there any thought on this?
We are working hard to address this issue in schools. This is an unprecedented amount of radiation in schools because you have all of these kids with devices, some on their laps. In high schools and middle schools, of course, they also have cell phones, which are emitting all the time. Those laptops are emitting Wi-Fi radiation constantly. And then there's also access points that are in the room on the ceiling that are also emitting wireless radiation constantly, even when the kids aren't on the laptops. And this is a situation that needs to be addressed. There are safer ways to do this. We wrote the Secretary of Education. We actually have a program where we're writing all the departments of health in every state, as well as all of the departments of education, and raising this issue, sharing with them how they can do it much, much safer. It does not have to be that the wireless is always on all the time. The kids don't always have to be on Wi-Fi also. There's so much that could be done if there again was political will to do so. They can use word processing where it's not always connected, or have kids connected with Ethernet like they do in many countries, where they're in many localities in other countries where the kids are all on wired internet instead of it being on wireless.
Whenever I go to the doctor or dentist, I think I'm the least liked person in the office, because what I do every time is I make a whole big deal about the X-rays. And everyone rolls their eyes at me, they yell at me, they tell me that you get more radiation from the sun. And I'm not really knowledgeable on it, so they might be right, but just intuitively, I'm not really that comfortable. What is the reality? When they do an X-ray of your back or your arm or your teeth, do you have any, is this a different subject than wireless radiation, or do you have any knowledge, like, are we supposed to, how concerned should we be about it? I mean, it seems like you might need this X-ray, dental X-ray sometimes. So any thoughts on medical and dental X-rays?
I'm not going to comment on medical and dental X-rays. I think that there needs to be a better job of addressing ionizing radiation in terms of medical procedures. We certainly know that with other ionizing, like CAT scans, that you want to do it only when medically necessary. And there's a time where and now they actually are saying, educating physicians on not always jumping on an imaging test unless it is medically necessary, because of some of what the science is showing around CAT scans, however many are happening you've had in your life. So you want to have what's medically necessary. I mean, when you're in the medical world, there's trade-offs. But I can't speak on that specifically, and I'm not an expert in that issue, actually.
Okay. Are there meters to measure 5G?
Well, that's a good question too. So the Safe and Sound of the Safe Living Technologies, Safe and Sound, some of them are, the RF meter is sort of ready, not to all the, I'm not sure it's for all the frequencies, but there's not at this time a meter that is measuring some of the higher frequencies. So we really need to, and I know that they're working on that. That's really needed, because there are some much higher frequencies that I don't have a meter that measures myself.
So in the end, what will you do to protect yourself from 5G? Obviously, we want to make sure it's not in your area if you can, but if you somehow ended up living in a home and there were 5G antennas all over the place, what is the best thing you can do if they're near you?
It's sort of a both and. Clean up your house, learn all the things that you can do to make changes in your home. You may need to do shielding, depending on your situation. If you do, get a building biologist and someone who is an electromagnetic expert to help you with that. I talked about addressing things in your home, but then I have to say, if you don't know who your elected officials are, like me, I did not know who my elected officials are, get to know who they are, because it has to be that we get involved in our local community. If you have cell towers all over, getting involved is going to help fix this. And there are many people who live in apartments who've actually been able to get it down to a level. So I would say, there's ways to address this in your home if you're in a very urban environment, but you do need to get some expertise, some help on that.
Okay, so for someone who just wants the super simple answers, if you were summing it all up, we're talking about wireless radiation and 5G, the forgetting about the details of the science, just the action steps. Do you have the most basic review of the most important things that you've discussed tonight and the most important things we could do to protect ourselves without any further detail? Just what is the specific things that you've mentioned tonight, and anything else that everyone should consider the non-negotiables, that if they want to protect themselves from wireless radiation, these are the basics that everyone would do to protect themselves and their family?
Okay, so you're just learning about the issue. Number one, your cell phone. Don't put the cell phone to your head. Don't tuck it in your bra. Don't put it in your pants. Don't put it in your spandex pants pocket. Keep it away from your body. It's emitting radiation. Learn how to use airplane mode. Turn antennas off, especially when you're not using them. Turn them all off. You make sure you turn off the Wi-Fi and the Bluetooth. Don't use AirPods. If you have kids, you want to minimize your kids' exposure. Cell phones are not toys. Don't hand your child a cell phone in the grocery cart. Keep the phone away from the baby and toddlers. Limit children's use, except for emergencies. What do kids need it for? I mean, is it really helpful, all what they're doing on it anyway? You want to reduce your secondhand exposure to kids as well, so and to yourself. So in your home, use wired technology. Use this is an adapter. You can plug the Ethernet into that and then plug in your laptop. Don't use cordless home phones. Instead, use a corded phone, which you can get with a voice over IP through your internet provider. You can also take your cell phone and actually plug it in with an Ethernet cord. And we have how to do that on our website, so that you can use your phone to do most of the things that your phone does, except for voice calls, unless you go through an internet application, and you don't have to be using the wireless in it. If you have video game consoles or Wi-Fi routers or printers, be aware that they are emitting radiation, and you can address those by getting printers. If it's a wireless printer, you can actually turn the Wi-Fi off of the printer in settings section, and just turn that on when you need it, or use a wire instead. You can get wired internet in your home. So you want to choose corded, not wired connections overall for all your peripherals, like mouse, speaker, especially speakers, keyboards. Don't use a smart speaker. That is emitting radiation all the time. Instead, you can use, like we have computers. I have more computers than I even want to tell you at this point, because I have 2 kids and I have a husband, and we're all working out of the house at various points in time. And we use our computers wired. We don't need to use a wired speaker, smart speaker, to do things. We use our computers, and we have speakers set up wired. Increase your distance from things that are emanating that you can't change. Oh, and be sure to opt out of smart meters. Get an analog meter. Get involved in a local group so that you can opt out if you're not able to in your community. And in your bedroom, clear out anything that's wireless from your bedroom. Don't sleep with your cell phone. Don't sleep with your head near a decked cordless phone base or a Wi-Fi router. don't charge the phone near your bed. Get an alarm clock, because I'm sorry, a battery powered alarm clock that doesn't have a cord. Make sure there's no electrical cords running underneath your bed. Make sure your bed's not backed up to a wall that has utility meters on the other side, or a Wi-Fi router on the other side, or any kind of wireless device. The first step people do is often just turning that Wi-Fi off at night in their home. Turn it off at night. Then at least your body gets that 8 hours of sleep, and it can rest and heal during the nighttime. I could go on, but I think I hit a lot of the simple ones. The first, really, they're the big ones.
What do you do about your husband? In other words, my wife thinks that what I'm talking about makes sense, but she also wants to function in the world. And I sometimes take an extreme point of view. And sometimes I say, okay, I've heard that it's better to have no power going in the bedroom, so we should unplug the TV and the lamps and everything. And I think she wants to be healthy, and she also wants to live in the real world. She doesn't necessarily, I don't know if she or most people want to take as many steps as was suggesting. So what do you do when you're more concerned about this issue than the person you're with?
Yeah, I'm sort of in your boat. It's a negotiation, and I definitely have tried to make as many changes as I can in the home, the things that I can control, that I can swap out, so to make it as convenient as possible for these changes to occur. And my husband has a recording studio, and you know what? He hardwired the iPad. He went through a lot of trouble to get that set up. But not everything is perfect in our life or in this whole issue. I mean, it's really a challenge. It's just like with food or with anything else. And I'm just doing my best on that front. But I think having solutions is really important. And it takes a little time to learn these solutions. Like, it's easy to say, okay, I'm going to use my phone on speaker. That's like step one. Use the phone on speaker. Don't put it to your head. And that kind of came quick for my loved ones. But everything else is like, they got to know it. They got to hear it. And I have Ethernet adapters throughout the house so that it's not so hard to find one, so that they can plug in their phone, because a lot of people come with phones and want to do all the things people do on phones. And so I have that available. But really learn about the things you can do. Do the low-hanging fruit first. And you know what I tell, what really worked for many husbands, not just mine. I've only had one, but I know people say when they start talking about the impact to sperm, when people hear that it damages sperm, and research has shown it impacts the health of sperm, that can sort of, I find my girlfriend calls me up and says, my son, when he heard that, my college age son, he was like, you know what? I'm not going to put that phone in my pocket. Because I know we're all in that situation where we have people we love, our children, our grandchildren, and we're trying to educate them, and they just don't want to know or think about this. But, little things, dropping things here and there, having the solutions, and being a respectful conversation. People will say to me, I don't believe you, and they get mad. Some people get irate about this issue. And there was a time when I was like very, well, I have to tell you all these 500 things. But now I just really stay calm, and I kind of go with the motto that people need to hear this over and over again in a calm way, feeling empowered. And eventually, I believe that they'll make the switch too, piece by piece. But we must continue to talk about it so that it stays top of mind, because it's completely invisible. So it's easy to just ignore it and pretend like it doesn't exist. Some people with their, whoever their loved one is, finding the thing that they care about and bringing that information to them. Because not everyone cares about their health, but they might care about climate, right? Or they might care about bees. Hey, I can talk to you about bees for forever and wireless radiation. There's research on all of this. So bring that's important, and also one step at a time, you know? So that's what I would say.